Welcome to this week's edition of 40 Weeks and More. My name is Edem Knight-Tay. Today on the show, we are talking about breast cancer, pregnancy, and childbirth. We all know that breast cancer is the leading cause of all cancer-related deaths in women. How complicated does it get in pregnancy and childbirth? Today on the show, Ramatu will share her story with us. She will tell us into details how she noticed she had breast cancer when she was 2 months pregnant. Thankfully to God, she has a baby who is 3 weeks old. We will hear all the story from her very soon. Remember also that 40 Weeks and More is our contribution to championing the SDG 3 that seeks to reduce the global maternal mortality rate to 70 in every 100,000 live births by 2030. Join us on the show. Thank you all very much for joining us this week on 40 Weeks and More. Let me say a very big thank you to our sponsors, Ernest Chemist Limited, to Ship Healthcare Specialist Medical Center, and to Labadi Beach Hotel. Also to our supporters, Deco Zone, The Better Merchandise, Our Lurie, and Lunch Avenue. The conversation is just about starting. But first of all, meet my guest.
My name is Ramatu. I'm on 40 Weeks and More, and I want to share my story about breast cancer and childbirth.
Hello, my name is Dr. Josephine in Ndaful. I'm a general surgeon at the breast surgery unit of the Kolebu Teaching Hospital. Today we are talking about breast cancer in pregnancy on 40 Weeks and More. I am your guest.
Doc, you're welcome.
Thank you.
And then Ramatu, you're welcome as well.
Thank you.
Great, and thank you very much for being my guest on the show today. Ramatu, how are you?
I'm fine, thank you.
Great, great. I am also fine, thank you. But tell me, when I say how are you, how do you feel?
I feel normal.
You feel very okay?
Yeah.
Great. So you will share your story with us, right?
Okay.
When did you, but let me first ask you, how old is our baby?
3 weeks.
Baby is 3
weeks.
weeks. Yeah. Congratulations.
Thank you.
You didn't invite me to the, how do you call it?
Sooner.
Sooner. Oh. The next baby I will be there.
No, I'm finished.
Oh. We'll talk about that later.
Okay.
But baby is also very fine,
Yeah.
right? Is baby suckling?
No.
Baby is not suckling.
Yeah.
I guess it's because of the condition.
Yeah.
Okay. But tell me, when did you first realize that you had breast cancer?
In August.
In August.
Yeah.
Okay. That's a couple of months ago.
Yes.
Were you pregnant at the time?
Yes, I was pregnant.
You were pregnant?
Yes.
Okay. So tell me the story.
I was pregnant like 2 months and 5 days.
Okay.
So I went to the hospital to check my breast, and they said I should do some labs.
Did you just go to the hospital to check your breast, or you?
I finalized something was in my
Inside.
right breast.
Okay.
So I went to the hospital first.
Okay.
When I went there, they asked me to do some labs and some scans before they told me it was breast cancer. So I should go to Kwalibu. They give me a referral letter to Kwalibu.
Okay. So they just did the labs and the test,
Yeah.
and then they just told you just like that is breast cancer.
No, they took something out of the
breast.
breast.
Okay.
And I took it to a lab at Standard Authority.
Okay.
That's the place. When I collected the lab and I brought it to them, that's the place they told me this is what is happening to me. So they will give me a referral letter to Kwalibu.
Okay.
So they first gave me the referral letter and I went to radiotherapy. That's where I started it from.
Okay, let's take it slow, right? You went to Kolebu.
Yeah.
Who did you go to see at Kolebu?
The doctor.
Okay, and then what conversations did you have?
I have so many conversations with
Tell me some of them. But you were pregnant?
Yeah, I was
Did you
pregnant.
disclose to the doctor that you were pregnant?
No,
Oh, how so?
because I was not having any book that shows I'm pregnant. So they asked me at the Kwalebu to go and do another scan. When the scan confirmed that I was pregnant, then when I gave it to them and they saw it and they asked me, am I pregnant? I said, yes, I'm pregnant. And they said, then I should hurry up and start the chemo very fast because of the pregnancy. By that time, I was not having any support because there is no money.
Okay, hold on. Before we get to the support and the money part, did you know what breast cancer was or is at the time?
No.
You didn't know?
No.
So when they told you had breast cancer, what did you think it was?
It's a pain
in the breast.
Yes.
Okay.
That's what I took it for.
That's all. But later on, you got to realize that it was something serious.
Yes.
How?
When they told me about the chemo, then I went home and told my husband that they said it's this and this, this and that. And he said, okay, then we should see what we can do. So I came back to them and tell them the price they are giving me, I don't have money and I don't have anybody who will support me to do it. So I came back and stayed out in like 3 to 4 months.
Without any form of treatment?
No. I was just in the house.
Okay. When you were at home, were you still feeling pains in the breast?
Yes, I was feeling pain.
Your pregnancy was developing?
Become big.
Your pregnancy was developing. Your breast had become big and you were still home?
Yeah.
Because you didn't have money. And what was your husband also saying at the time?
He's not having any money.
He doesn't have money.
Yeah.
So eventually, how did you go to the hospital?
One of my friend in Kaswa, she was also having the same problem. But when they give her a referral letter, they said she should go to surgical.
Okay.
So she's the one who told me to go back to the hospital, back where they gave me the referral letter.
Okay.
For them to give me another referral letter to surgical.
Okay.
So when I went and told them, they said okay. Then they gave me another referral letter to surgical.
Now let me ask you, your pregnancy was growing. Were you attending antenatals?
Yes, I was attending antenatal. When I went to the Kwalebu radiotherapy, they asked me to go to the ANCs for me to start the antenatal. So I started the antenatal in Kwalebu. Okay,
antenatal is when you are going to have checks on your pregnancy and all that.
Yes.
They were doing that?
Yes.
And they knew you had cancer?
Yes. It was written in the letter that I brought to them, so they knew everything about it.
And at the time, had you started your treatment?
No.
So what were the people at antenatal also telling you? Weren't they concerned that you weren't seeing a doctor for the cancer?
No. They asked me about it and I said I'll start it when I get the money. So when I started the antenatal before I went to the surgical ward.
Okay. Tell me how you got the money. You were telling me about your friend B.
When I came to the surgical ward, I went in some process before I started the chemo. But when I went and asked, their price is lower than the radiotherapy. So when I told my husband about it, that one he can afford it for me to start. So I came to the hospital with him and they asked me to do some labs and to go and collect some labs at Standard Authority back before I'll come and start. So when I came there, they gave me the lab, I brought it, the doctor confirmed and asked me to go to 2nd floor to see the nurses over there.
Ramatu, I thank God for your life. But did you know that you could have died?
Yes, I know.
You knew?
Yes.
At what point in time did you know that?
I knew it because there is no any support, that's why. But
no, I mean that initially you didn't know what the whole breast cancer thing was. You only thought that it was a pain in your breast that could go away, right? And then you noticed that as your pregnancy was progressing, the breast was also increasing and you were still feeling the pain and there was no money. So you were home. Whilst you were home and not getting treatment, did you know that it could have been fatal and you could have lost your life?
Yeah, I know.
But you still...
because I have no support, so I depend on God.
Okay. This is 40 weeks and more. We're talking about breast cancer, pregnancy, childbirth, and everything around it. I'll turn to Dr. Ndaful now. Doc,
Yes.
you've been listening to our conversation, and I'm sure you can see my bewilderment, right? So I want to find out how safe, first of all, is pregnancy when you have such a condition like breast cancer?
Okay. So the pregnancy is fine. I wouldn't worry about the baby at all.
Okay.
I'm more concerned for the mother's life, for the cancer with the mother. The babies are tough. They are like parasites, excuse me to say. They will be fine. The babies always come out fine. Yes. So it's something we are able to treat together.
Okay.
The pregnancy and the cancer. So like she said, she came to Kolebu, she was directed to the gynecologist. So, sorry, the obstetrician. So we have a particular team of obstetricians. We work together, we discuss. Pregnancy in breast cancer is quite a special situation. Well, for all breast cancers, but in particular in this situation, we have what we call a multidisciplinary team.
Okay.
So it's not treated by just one doctor. You know, you have the obstetrician, you have the breast surgeon, you have the oncologist, you have the pharmacist, the breast care nurses, clinical psychologists,
Everybody.
oncology nurse, everybody is on board, and we discuss what is best for each particular patient. So it's teamwork, and we are able to manage them all the time. She's certainly not our first such case. We have several success stories, and you can safely manage pregnancy and breast cancer together. But I'm not saying if you have breast cancer, go and get pregnant. If incidentally you happen to be pregnant and you develop breast cancer, we will see to it.
Okay, now that is a very interesting point you make. So doctors won't particularly advise that, like you won't sit on 40 weeks and more today and advise that it's okay to plan for pregnancy whilst you have breast cancer, right?
After treatment, after you've been cured, then you can plan to have a family.
Okay.
And even that, at that point, is still a discussion with guidelines and everything. But not whilst you've been diagnosed with breast cancer. Because when we are treating breast cancer in a non-pregnant patient, we have a treatment plan, and then the pregnancy can interrupt it and delay it. It's best just to go through your treatment plan with no interruptions, back to back. When you are done and we declare you cancer-free, then we can have a discussion on how to start a family. And we have several survivors who've now started their families.
Declaring you cancer-free can take years, right?
It can, but I think that within 2 years, we've treated you and it's not come back, and it was early breast cancer, it's not come back within 2 years, your chances of surviving forever are really good.
Okay. You also mentioned that breast cancer and pregnancy is treated as a special case, and you bring everybody on board to have all those conversations, and then the right methods are chosen for the patient. Why is it so special?
Because there are 2 lives here. Now, treating breast cancer alone is complicated enough. We have surgery, we have chemotherapy, radiotherapy, there's this special drug targeted therapy, there's hormonal therapy, a whole lot of therapies. So we have to time the treatment options with the pregnancy. So what we can do in the first 3 months of pregnancy, we may not be able to do in the second 3 months, or we cannot do in the last few weeks. So we know what is safe during the first trimester, and we know what's safe during the second trimester, and so forth. So it's a balancing act. So first trimester, for instance, we intentionally wouldn't give chemotherapy.
Okay.
We might do something else, but we wait till you've crossed third trimester, then immediately we start chemotherapy.
Why? Why can't it be done in the first trimester?
Yes, so the first trimester, the fetus is very delicate. Even without treatment, anybody who is pregnant, the first trimester is crucial. That's when the fetus is forming. So if there's going to be any anomaly, any miscarriage, it may be third trimester. But when the baby has moved out of the first trimester, we know we are good to go, and the chemotherapy is safe at that time. And we know the type of chemotherapy that is safe for pregnancy. So there are certain chemotherapeutic drugs we use for non-pregnant cancer patients we wouldn't use in the pregnant one. So once the patient tells, that's why it's important, they shouldn't hide it. Once they tell us, we know what will be good and when to start, okay? During the first trimester, instead of sitting and waiting for a very long time, waiting for you to get second trimester and we need to do something, we can actually operate. You can safely have surgery on your breast whilst still pregnant. First trimester, second trimester, third trimester, anytime really we can operate. What we can't do during pregnancy is give you radiotherapy because it uses radiation.
And that can affect the baby.
Exactly. But because there's so much to do, the radiation can wait till after you've had your baby. Then you have radiation. The special injections I talked about, the Herceptin and then the hormonal tablets too, you don't mix it with the pregnancy. But we plan everything such that after delivery you can do that part. But whilst pregnant, chemotherapy and surgery can certainly be worked out.
Okay. So I also understand that when you're pregnant, your immunity is already, lower to an extent. And then cancer also poses those threats to you as well. Now you have all of these two things that you're dealing with as an individual. How does that play out?
Yes, so whilst on treatment, we keep a very close eye on you. We can ask Ramatu, we keep doing labs. You get chemo today, 10 days time you do a lab. Then the next 10 days you do a lab. When you come, we just ask you a few questions. We check you out whether you are fit for chemotherapy. So we are monitoring you. They have the contact for our chemotherapy nurses. They know where the breast unit is. So we're keeping a very close eye on you. And every so often, the obstetrician knows when to do a scan to check on the growth and the development on the baby. So everybody knows what they are doing, just keeping an eye on you. So yes, chemotherapy, pregnancy, cancer, all can lower your immunity, but will not give you more than what your body can handle. So we give you instructions how to take care of yourself, staying away from infections, hand washing, face masks are very good. So all these measures are put in place, a healthy diet and all that. So you should be able to go through this safely.
How well did you feel, especially so when you started your treatment?
I feel well. I feel better.
You were very okay. I mean, when you go, so you were pregnant. The pregnancy, sometimes I know that you have nausea, you probably would be throwing up, sometimes you don't feel too well and all that. I have also heard that sometimes, were you taking chemo?
Yeah, I was taking
I've also
chemo.
heard that sometimes chemo makes you feel that way as well. You didn't feel that
I
way?
didn't feel anything.
So like what, you can go and take your chemo and you are still very strong and you are going and coming?
Normal.
The baby too?
Normal.
You are a blessed woman. Wow. But at what point did you ever feel low, or have you ever been afraid that the cancer could either rage and, have some very adverse effects on you, on your baby? Do you think about that sometimes?
No.
Okay, so I'm learning something from you. How did you manage to keep such a positive disposition? I'm interested. That's what we want to learn from you today. Like, how did you manage to keep calm, to be positive, not to be afraid, not to think that I could either lose my baby or lose my life, even though you knew you had cancer? How are you keeping this calm?
I pray to God every day to help me, because I don't have anything to say again. What I'll say is, I thank God for doing everything for me easily.
So it was just prayer and your belief in God. How about your treatment?
That's good.
Were you following through with it?
Yeah.
Every single one of them?
Yeah.
So when you started treatment, you had money all the time?
I only took 2 chemos before I gave birth.
Okay.
So now that I've given birth, I'll go and continue my chemo.
When are you supposed to start?
I will go to surgical ward on Wednesday for them to give me a date to come and start.
Okay, so and you're ready to start it?
Yes, I'm ready to start it.
I hope that you won't say that because you have your baby, you're going to abandon the treatment.
No. I will not play with it. I have to go and continue my chemo.
Tell me why you won't play with it. I want to know what you know now.
Because it has helped me. Maybe without it, I can lose my life or my child. But when I started it, I was strong and brave that hospital, sometimes people use herbs to spoil some things, but it does not help. But if they ask you to go to the hospital and you go and the doctor gave you some instructions, you have to follow what the doctors will tell you to do. It will help you more than to somebody will tell you go and use herbal medicine. It's good for the breast. No, I don't advise people to use herbal. I advise them to go to the hospital so that everything will be okay for them.
Did you ever try herbal yourself?
I tried it.
Tell me about it.
Because the time I was not having money, my husband went and they gave him some. If I even do it, I don't see anything.
So he got some herbal medicine for you?
If I use it, I don't see anything.
How were you using it?
You scribe it on the breast.
You weren't drinking it?
No, I was not drinking it. It's only to use it to scribe on the breast, but it was not helping me.
How long did you do that?
I didn't even reach 1 month because I use it like 1 week and it's not helping, so I stop it. Still it's in the house.
The herbs are still at home?
Yes, it's there. I didn't use it.
I see.
Because if I talk about hospital, maybe it seems like there is no money and you are forcing me to do what I can't do. I said, no, I'm not forcing you to do what you can't do, but people are telling me to go to the hospital. I have to listen to what people are saying. Because if I use it, I don't know what I'll face in it. So let me go to the hospital. And I went there with him, and they confirmed for me to come and start. So the first day I went there with him to the surgical ward before I took my first chemo. The second one, I went alone. The third one, I went and they told me, no.
You can't take it.
I can't take it.
Were you close to delivery at the time?
Yeah, I was 38 weeks at that time.
Okay.
So when I went for my third chemo, they said I should come to the ANC ward on Sunday. So they didn't allow me to do the third chemo. They told me if I finish giving birth, I can come and continue. So,
but I hope that with the knowledge you have gathered, you will look back and forgive your husband, because both you and your husband at the time didn't have knowledge.
No, I've forgiven him.
Yes, and forgive yourself too.
Absolutely.
And forgive yourself too.
Myself too.
Exactly. Because, I mean, I spoke to your husband, and I think he is a very, very caring human being.
Oh, he's caring.
Yes, he is very caring, because, I mean, he wanted to understand why you were going to be on the show, followed through. He says he'll call again to check and everything. I see him as a very sweet man. So if he said he didn't have money, I believe that truly he didn't have it, and also because he was quite ignorant at the time. But now that he knows, he's supporting you through your chemo and everything and through your treatment. Please handle him like a baby for us. Okay. He's a sweet man. Doc, she wasn't allowed, or she didn't take her third chemo because she was 38 weeks. I want to understand a bit of that. Yes. She could take it at some point, but couldn't take it at some point. How so?
Yes, so it's all about the right timing.
Okay.
You mentioned something about reducing your immunity and all, so based on that. So we know that a lady may have her baby anytime 37, 38 to 40 weeks. So we don't want them to have had chemo and their immunity is low at the time. And usually it takes 3 weeks to recover from chemotherapy. That's why we give it every 3 weeks, because you recover from one, then you're strong for the next. So after 34, 35 weeks, we don't want to give you chemo, so that when it's time for the baby, you'll be strong to have the baby and not run into any complications.
Okay. But what if Anyway, you are the doctor, and I am sure that by the time the doctors are telling you that we won't give you chemo this time, you people probably know that it is safe for her not to have chemo, and she still is going to be well to be able to deliver her baby, right? Because I was going to say that we have heard of instances where they say the cancer could be very aggressive. So in those instances, if it's not really responding to all the treatment you're given, and you may have to stop her from chemo. In her case, 38 weeks, baby is 3 weeks, so that's like what, 5 weeks, and she hasn't had any form of treatment from that time till now. Couldn't it be, what's the word to use?
Okay, so
could it not affect her health adversely?
You're concerned about a long break in treatment. Yes, so it's all a discussion and a plan. Everybody's is different. We know that the babies can survive 36 weeks if they come out naturally. You know, people have preterm babies and they survive. And sometimes, because we want to avoid a long break, in discussion with the obstetrician, they will decide to deliver the baby early. So sometimes they do induce labor because we've done chemo and we're on break. So maybe about 3-4 weeks after your last chemo, they will induce labor. So instead of waiting for you to deliver at 40 weeks, they may let you have your baby around 36, 38 weeks, just to come a few weeks earlier. And then actually 3 weeks after delivery, if the obstetrician sees you and you fit, you're strong enough, we can start
to treatment.
The treatment. Okay. She had her baby 3 weeks ago, so by next week we'll see her and then put her back on the chemotherapy.
All right, 40 weeks and more. A lot more is coming. Please stay. Thank you very much for staying tuned in. This is 40 weeks and more, and I have been talking to Ramatu and Dr. Ndaful. We've been looking at pregnancy and treating cancer, in our case breast cancer, and then delivery and everything around it. And Ramatu has been telling us about how she woke up one day and felt like she had a pain in her breast, and so she decided to go to the hospital to check. And then because of the pain, she went to check, and she went through labs and scans here and there, and then they told her it was breast cancer. What did she do after then? She said she didn't have money, and so she went to stay at home for about 4 months, because she couldn't afford the treatment. And within those 4 months, she tried herbal medicine. She tried it for like almost a month. She realized that it still wasn't working. She stopped, and she still stayed at home until a friend came up and said that no, you can't be home, especially so considering the fact that you have breast cancer and pregnant as well. That's when she took a step and started treatment somehow. To God be the glory. She has a beautiful baby, and she's sharing her story with us. Let me say a very big thank you to our sponsors, Ernest Chemist Limited, Shape Healthcare Specialist Medical Center, and also to Labadi Beach Hotel. And to our supporters, DecoZone, The Better Merchandise, to our Luri, and also Lunch Avenue. Rama.
Yes, madam.
Are you breastfeeding baby?
No.
Why?
The doctors said I should not breastfeed her.
Okay.
I should give her formula, so that's what we
You're
are giving
doing. Did the cancer affect both breasts?
No, only the right one.
Okay. So, Doc, why can't she breastfeed with the one that's not affected?
All right. So in this case, she's about to resume her chemotherapy. So when a lady is on chemotherapy, we don't want her to breastfeed because we don't want it to pass through the breast milk to the baby. That's the only reason why. So it depends on your treatment plan. Now, everybody's cancer is treated differently. So yes, we have some cancer patients who are breastfeeding from one breast. Maybe because we've removed the cancerous breast, they have one breast, and they are not on chemotherapy.
Okay.
So if you're not on chemotherapy, and you are not taking these hormonal tablets, you're not on any cancer medication, there's even the injections. So long as you're not on a cancer medication, you can breastfeed. And you can use one breast to sufficiently breastfeed and do exclusive breastfeeding for a baby. So everybody has a different plan. So depending on your situation, we'll tell you whether you can breastfeed or not.
Okay. Now let's talk about the herbs. We hear that a lot.
Yes.
Every October, when we have to have conversations around breast cancer, people have tried herbal medicines upon herbal medicines, and they only start running to the hospital when they realize that it's getting terrible and the herbal medicines are not working.
Yes.
Let's talk about herbal medicine in treating breast cancer, and especially so in the case of Ramatu, who was pregnant as well. You talked about the fact that there are 2 lives involved here.
Right, yes. Now, Edem, the situation with the herbal treatment is getting out of hand. It doesn't work.
After all these awareness we are creating?
Yes, because we are happy to hear it, and we have hope that, oh, we can get cure from herbal treatment. And it's because of the fear of the hospital treatment. Everybody has heard that when you come to hospital, we remove your breast. We'll give you chemotherapy and your hair will fall out. So everybody is looking for an easy way out. Right. Or Ramatu, is that not what they said?
I was going to ask her why she's laughing. Ramatu.
That's exactly what they said, you see. But we are fighting to save your life. So if we have to remove one breast to save your life, then we have to. If your hair has to fall off and grow back in a few months,
when you're well,
then we have to, because the hair always comes back. It always does. But with the herbs, it doesn't work. We say so because we have a whole lot of stories. Even Ramatu didn't even use it for more than 1 month. There are those who have stayed away and used it for 6 months, 1 year, and they come and the situation has gone out of hand, and there's nothing nobody can do about it. The breast can even be rotten, it's smelling, you can't operate, and the patient can actually beg you, doctor, just remove this breast for me. And not that we are being wicked, but at that stage, the breast is fixed to the chest, and it's actually not possible to surgically remove it. We'll give you some chemotherapy, try and shrink it, you see the sore begins to heal, but only up to a certain point. And we have countless stories, countless people. I haven't seen one person so far who has been treated with herbs. And there are a lot of advertisements around, on TV, on radio, social media, advising people to take these alternative treatments. But I haven't seen one that has worked before. And when they come to us, it never ends well. Now, the thing about cancer is it's a ticking time bomb. There's a window period within which you can cure it, and that's when it's early. Okay, so when you come and we tell you that it's spread to your lungs, your liver, your bone, your brain, at that stage, you may not necessarily be dying at that very moment. But when it's crossed that line, we know it's not curable. So we'll still treat. We'll probably not operate on your breast, but we'll give you chemotherapy. And you yourself, you see that the cancer is shrinking, you are feeling better and so forth, and you feel fine. The question is for how long? Eventually, you know, cancer is a stubborn disease. Eventually it comes back. When it comes, we will attack it with more chemo, and you feel better and you go. When it comes again, we'll attack it, but only up to
a certain point.
Yes.
Because so those vital organs may have been damaged.
Yes. Yes. So the important thing is to catch it when it's early. At that stage, we operate, we give chemotherapy, radiation, all the medication that go with it, and we should be able to achieve a cure.
Doc, would you say that, because you mentioned that sometimes it's the fear of the hospital treatment, would you say that, yes, we're telling people that early detection saves lives, there's treatment if you detect it. Would you say we probably haven't demystified the treatment enough for people to understand that it's just the way it has to be done. Because if people are still afraid of the treatment, then there is an issue there.
Yes, yes. There are a lot of myths and misconceptions out there. I think they say when you remove your breast, is it 6 months or is it 1 year, you are dead?
Oh.
So it has nothing to do with the surgery. But the problem is the person came late. So we tried. You know, we operated surgery. Then later on we realized that, oh, it's already come back and it's spread. Then the person dies from that. It wasn't the surgery
that kills the
because
person.
we have countless people who have had the surgery 10, 20 years down the line, they are fine. And it's only because they came early. So these are all things people hear, but it's because they haven't understood why the person died. They only heard they came to hospital, but they won't be truthful and say they came to hospital late. That part is always missing in the story, you see. Or unfortunately, we do have a few people who have very difficult to treat cancer, who come early and doesn't respond to treatment. They are very few. But, you know, by and large, if you come early, we should be able to treat and cure you of early breast cancer.
Great.
Yes. And the myths and misconceptions there too around pregnancy and breast cancer. That when you are pregnant, when you come, we will ask you to abort the baby.
Pregnancy.
If so, that may be 1 or 2 particular cases, but most of the time, and in fact, I haven't been involved in a case for how many years now where we've asked the mother to terminate the pregnancy.
Okay.
Whilst you are pregnant, we can still go through your pregnancy, have your baby, and save your life. So people are hiding. Now, if I come, they will say, I should abort my precious baby. That is not true.
Oh.
That is not true. You don't have to lose your baby. I've had 1 or 2 unfortunate stories where people went to seek advice and they said you have to have the baby first and then we treat the cancer. That also
is not true.
Is not true. We hear that if you have cancer and your baby feeds on it, it might affect the baby. That is also not true. Cancer cannot be transmitted through breast milk or any other means to a baby or any other life. Yeah.
So asking a mother like Ramatu not to breastfeed the baby is only because you don't want the chemo drugs to be to get to the baby.
Exactly.
Not because the baby can get breast cancer from suckling.
Exactly.
Okay. So that we have clarified. Now, in the case of pregnancy, you know that when you're pregnant, at some point in time, your breasts start becoming big. Sometimes, you know, it engorges a little bit. And at that time, if it is a looming cancer, how are you able to tell that this is a looming cancer and not my breasts engorging because I am, you know, pregnant?
Yes. You know, honestly, it can be quite confusing because pregnancy comes with all these changes normally. So we do actually see these women coming late because initially they thought, oh, it's part of
the pregnancy.
Sometimes they may even ask a health worker in the community, so this is all pregnancy. But it's always good to get it checked out. Let a professional see it. Do a scan. And scans are also very safe in pregnancy. We'll never ask you to do a mammogram when you're pregnant. You do a scan. And it will be able to tell the difference, whether this is just the pregnancy changes or there's an actual suspicious or cancerous lump there. And because of that, the women tend to come late. Because of the confusing picture, you can't blame them. So they come late. So you realize that the survival of late disease is not good. So you tend to get more pregnant women coming late than non-pregnant women because of all the confusion with the breast. Another thing that doesn't help too much too is that pregnant women are usually young women. And young women too, for some reason, tend to get the aggressive types of breast cancer. Well, not all of them, but we tend to see the more aggressive ones in relatively younger women below the age of 40.
About, from what age to 40?
Oh, from 20s to 40.
Oh, wow.
Yes, that is rather young.
Wow.
Usually after 40, or in elderly women, 65 and above, they don't seem to get the very aggressive types commonly. Yes, so because the patients, they come late, and they get the more aggressive types, sometimes it can be quite a difficult situation when they are pregnant.
Interesting. Breast cancer, pregnancy, and childbirth. That's what we are talking about on 40 Weeks and More today. And my guest, Dr. Ndaful and Ramatu. Ramatu?
Yes, madam.
I'll say yes, madam. So tell me, you're not breastfeeding your baby, and on this show, we talk a lot about pregnancy, baby, bonding with baby and all that. I'm sure it's one of the things that women will fear. I am not breastfeeding my baby. And of course, when you go to antenatal, they tell you that breastfeed your baby. You should do exclusive breastfeeding, maintain eye contact with the baby, bond with the baby, and all of those. What are you doing since you are not able to breastfeed baby? You're given formula, but how are you able to? I just want to know how you are doing. Is that your first child?
No.
Baby
My
number?
five.
Baby number 5?
Yes.
Wow. Congratulations.
Thank you.
But all the other babies, you had to breastfeed them.
Yes.
And you know how it feels like. So how different is it as you're not doing it with this one?
Normal. No, because there is not any breast milk in my breast.
But how are you maintaining the bond?
Like how?
Okay. You know when you're breastfeeding your baby, you're holding the baby in your arms, you're breastfeeding, the baby is smiling at you, it is touching you, you're smiling back at the baby. You are not breastfeeding this baby. So how are you able to do that with a child?
If you are holding her, she feels like she wants you to breastfeed her, but because she's not been breastfeeding, you have to give her food for her to take.
So you just feed her. But when you're breastfeeding, do you also try to still maintain eye contact and smile at her and all that?
Yeah.
So that
she normally smiles.
And then you smile back.
Yes.
Oh dear. Doc, there's a lot you will miss about that, right? As a mother.
Yes.
So what
I
advice do
think
you give, women who come to the hospital with such conditions?
really, you just do the best you can. You can still, hold your baby and entertain your baby, bond with your baby. Whilst you are using the bottle, you still make eye contact, sleeping with your baby and all. So the mothers are able to manage. And when they come, they meet other mothers, they share their stories and get support from one another. We do have a clinical psychologist on our team. We have a navigator, breast cancer survivors, breast cancer nurses. So they all come together to support these mothers, these patients. And some way, somehow, women are strong and they are able to pull through, and the babies are even stronger, and they all come out really well. We have, babies who've gone through, their mothers have gone through breast cancer. They've gone through chemo, and you should see them, very normal children running around, go to school, intelligent. The chemo doesn't affect them at all. They're not breastfeeding, doesn't affect them at all. They all come out with very normal and very smart babies.
Great. Now my next question, how do you carry the men along? Because pregnancy is not, of course, it's the woman that incubates and carries and everything. And when you're pregnant and you have had to deal with breast cancer, or any form of cancer, I'm sure that will be even more daunting, because the pregnancy alone is another challenge on its own. How do we bring the men along? Are they understanding? Do they know what it is like to have breast cancer and still be carrying a pregnancy and have a baby? I want to know where the men are positioned when it comes to these, and some of the interesting conversations you probably have had.
Well, some men, Ramatu's husband has been supportive.
Very.
Some women are fortunate, their husbands are really supportive. Some men even come with their wives for chemotherapy. It's a really beautiful thing to see.
Wow.
Some men may not necessarily come, but they are supporting them emotionally and psychologically. Financial support too is important. A lot of men are doing really well. But I can't say that for all the men. We have some very mean men around who have, you know, stayed away from their wives. They've given them alternatives. One or two unfortunate stories where the men have even left their wives.
Because they have breast cancer.
Because of breast cancer, yes. I guess when pregnancy too is in the picture, it complicates the issue. Maybe the man will be more worried about the baby than his wife. It's very complicated. But we do encourage the men to come along and also come to get information and facts. Because when you have the right information, the right facts, and all the myths are cleared, then you see the men come around the understanding. In the case where there's a baby involved, the men too can be supportive, you know, whilst the patient is going through chemotherapy and all. It's also a chance for the men to bond with their babies. So some men have done a great job, and I think we should applaud them for that. There's lots of room for improvement when it comes to our men, but I believe we will get there.
Now let me try and ask a not so nice question before we wrap up. So we know about preeclampsia and, you know, eclampsia in pregnancy. There are some women who are pregnant with diabetes and lots of other conditions. So if you have a woman, or I don't know if you have experienced a woman who has some other conditions, in addition to breast cancer and pregnant, how do you handle those?
Okay, so I did mention the multidisciplinary team. So anybody who would normally be involved in handling any other condition will be part of the team. So diabetes, that's gestational pregnancy, is nothing new, and the obstetricians are very good at handling that. So they do take care of that. Usually it's nothing complicated by the cancer, but it's a pre-existing condition. So we just go through the routine treatment steps for that. Yes.
So it really doesn't make it any worse?
Not necessarily.
Okay.
Not necessarily.
And then tell me, in what circumstance or under what circumstances would a doctor have to tell a patient that, you know what, you may have to have this pregnancy terminated?
So that would be a very rare situation. But perhaps the pregnancy is very early.
Okay.
And maybe the cancer is so advanced and you really, really need to start chemotherapy ASAP. And I mentioned it's not the best
in the first
trimester.
Yeah.
So it's usually a conversation with the patient and the patient's family. The patient has to understand before we would go ahead with such a drastic condition. Most of the times we should be able to work something out. So a lot of the decisions we take also depend on the patient's preferences. So it's always a discussion, and there's always a plan A and a plan B, and even sometimes a plan C. So in discussion with the patient, what the patient wants, we do. Some may decide that irrespective, they'll take their chances and continue with that pregnancy. We will support them through it. Hardly do we insist. We just want to put all the pros and cons before you, and then you take the decision what is best for you and what is best for your baby.
Right.
But those type of cases are very few and far apart.
Okay.
If I may, one thing we haven't touched on is having a baby after the cancer treatment. So usually, even for the patients who are on the hormonal tablets, usually you don't want to get pregnant whilst on the tablet. So maybe you don't have any children and you really want to have a family, that's great. Hopefully, you should be on your hormonal treatment for at least 5 years, and then you are done, and then you can start a family.
Okay.
Some people may want to have a family before that 5 years. So we do have a conversation and see, can we do 2-3 years of the tablets, take a break, have a baby, come and continue? There's always a plan, and it varies. It's not one plan fits all. Now, before we start the treatment, we will ask you about your fertility wishes. Some will say they have enough children, really, they don't mind. Some want to now start a family. The options would even include harvesting your eggs and storing them for years. Whenever you are done with treatments, whenever you feel okay, if you want, you can then also go back for that egg
and have your baby.
I think the obstetricians would be able to give you more details on those options. Yes. So from the get-go, it's good to start the discussion about what your fertility wishes are, whether you want to have a child after or not, and we adjust your treatment plan to suit that.
Thank you very much, Dr. Ndaful. Ramatu, what will be your final words? There are mothers who are listening to you, mothers who probably are battling cancer and they don't want the treatment, they're using herbal medicine. What advice do you have for them?
My advice for them is to come to the hospital for the treatments. It will be better for them. There is no any problem in it. They start it, they are fine. So I advise them to go to the hospital for their treatments.
Thank you very much.
Thank you too.
And Doc, your final words?
I would say early detection. That's the key to surviving breast cancer. Burying your head in the sand is not going to make it go away. And then how do we get to that early detection? And it's the breast screening we've been talking about. Breast screening is not only October come and then we examine your breast. Breast screening, the true breast screening, is actually getting your mammograms done. You know, the mammograms and the scans can detect the cancer when it's so small before it becomes a lump that we will find. So we encourage every woman once a year, especially once you've hit that age of 40. You need to start doing your mammograms. Some, for some reason, are afraid of mammograms. At least just do a scan. And if we can pick this really small, you have such wonderful options and you have a very good chance of a cure. We don't always have to remove your breast. If it's really small, we can remove the cancerous lump. Even if we have to remove your breast to save your life, so be it. And even now, we are doing breast reconstruction. We can remove the breast and construct a new one. And a few people who've detected it very early even managed to skip the chemotherapy that everybody is afraid of. Some didn't have radiotherapy, didn't have chemotherapy. They just had surgery and they were done because of early detection. So I think the emphasis is on early detection. Early detection.
Great.
And then listen to Ramatu's advice. Come to hospital.
It's very important. So this is how we are wrapping up on 40 Weeks and More today. Breast cancer is not death sentence. If you have listened to Ramatu's story and you have listened to all the advice Dr. Ndaful has given, all you have to do is ensure that you're screening, you detect it early, and there's so much that can be done to save your life and the life of your baby. My name is Edem Knight-Tay. Thank you all very much, and we'll see you next week. Bye.